Hello everyone, I'm Dr. Erfan Salloum. Some of you have met me before. I'm a specialist orthodontist in Dublin Orthodontics. On behalf of the team, I would like to provide all our patients with an update concerning the COVID-19 situation. So in this short video, I want to discuss a few things that patients can do while we can't see you in the clinic, just to make sure that your treatment is still progressing nicely. And then as soon as we are able to see you back in the clinic, then we can continue with minimal interruptions. So let's start by talking about the treatment progress. Normally we would like to see you every 4 to 6 weeks. Unfortunately, in these circumstances, this may not be possible for some of you. So what I want you to do is, if you were wearing traditional fixed braces or ceramic braces and you were told to wear the rubber bands with them, and you were told to wear the rubber bands full time and you've been wearing them for more than 5 weeks, then what I would like you to do is to reduce the wearing time from full time to night time only. While we do want your teeth to move, but at the same time we don't want them to move too much without supervision. If you are wearing clear aligners such as Invisalign, then you can continue wearing them as you were told before, and we should have no problems. If you were running low on aligners, what you can do is you can reduce the changing time. So if you were changing them on a weekly basis, then you can change them every 2 weeks. If you are currently on your last aligner, then what you can do is you can phone us and we will make an arrangement to give you some more. If you were wearing lingual braces, then the wires that we normally use, they tend to work for anywhere from 4 to 6 weeks. So even though we are not seeing you now, there is a very good chance that the wires are still working. And then as soon as we see you back in the clinic, then we will make an adjustment. If you have a child who is wearing a removable plate or an appliance such as a twin block appliance, then they can continue wearing the appliance full time as normal and we should have no problems. If you are a patient who finished their treatment and currently wearing their retainers, then you can continue wearing the retainers as you were told by your orthodontist, and just make sure not to skip any nights, because then the teeth will have a chance to move. The second thing I want to discuss here is oral hygiene. Now this is very important because we normally check for that in the clinic every time we see you. But now it will be your responsibility to make sure that the brushing is impeccable. You have to brush your teeth at least 3 times per day. You will have to use obviously a toothbrush and a fluoridated toothpaste. And you will have to use the proper technique, which is a circular motion. Just make sure that you're cleaning the braces, the teeth and your gum. And what I want you to use is a fluoride mouthwash 2 times per day at separate time to the brushing, just to add an extra protection to your teeth and gum. You also have to be very, very careful with the diet, especially now we are in a lockdown. Some patients may tend to snack on sugary sweets or treats, and this may cause permanent damage to the teeth. So what you have to do is you have to reduce the sugar intake, and also you have to reduce the fizzy drinks, because these will also cause damage to your teeth. You also have to avoid foods that are too hard or sticky or chewy, because these foods may cause damage to the brace and may lead to breakages. Now, if you are experiencing a breakage, you may see that the bracket is a little bit loose, but it should be still held by the wire. If this is happening and there is no pain or discomfort, then it is fine to leave it until your next visit. However, if the bracket snapped, and this may happen on the very back teeth, and the wire was loose and it was causing any pain or discomfort, then in those cases you can do two things. The first thing you can do is you can use the clear sticky patient wax. If you don't have, then phone us and we'll make an arrangement to give you some. The second thing you can do is you can use a clean nail clipper and wash your hands before, move your cheek, and then with the clipper you can clip any sharp bits in the wire, and this should sort out the problem. If you are wearing clear aligners such as Invisalign and you notice that the attachments on your teeth are breaking, then this is not a major problem. You can continue wearing your aligner as normal, and then as soon as we see you in the clinic we will fix the problem. If you are wearing lingual braces, then what you have to do is if you notice that the bracket is loose, it should still be held by the wire, but if it happened on the back teeth and the bracket was completely loose, then what you will have to do is you have to spit the bracket out and store it somewhere safe, where you have to bring it back to your next appointment so we can fix the problem. I want to end this video on a positive note. Keep in mind that this is a small hiccup in the overall progress of your treatment. This should not affect the quality of the treatment outcome. However, you may have to wear the braces for slightly longer than first anticipated. And finally, keep following the HSE guidelines regarding the COVID-19. Make sure to wash your hands, apply good respiratory hygiene, and make sure to apply your social distancing, and above all, stay positive and stay strong. We got this. Thank you, and talk to you soon.